for those of you who have not met me before, I'm Dr. Kath Cosgrave, and around the group we have various committee members or community connectors who are involved in various community connector program sites, all at different stages of development. So I'll just start with acknowledgement of country. I'd like us to take a moment to reflect on the meaning of place and belonging. And in the spirit of reconciliation, I wish to acknowledge the traditional custodians of the places that we meet on today throughout Australia, and recognise their continuing connection to country, culture, community, land, sea and sky. And I pay my respects to elders past, present and emerging. Okay, so we've got some guests with us today. So just hands up if people could just show me that they read the email this morning and know what we're doing. Okay, I'll just quickly recap. I'm going to get Esther up. She's up on my top left, but I don't know where she is for everyone. Just to introduce the South Australian group, tell us a little bit about the pilot that's going on there and why you've joined us today. And then Brie. Brie, do you want to wave to us? Brie is one of the committee members for the mid-coast of New South Wales, a site that's been operational since about August last year, but has been in planning for many years. So, and Brie, I'm going to interview Brie and talk about all the good things that they're doing. And hopefully we'll get Kate. Kate will join us soon. Kate was around. Kate is their community connect. And then I'll open it up to questions. And then if we have time left, we can have more general questions from the board. Esther, can you unmute? I'll unmute you. And can you just introduce yourself and your other attendees, please?
Absolutely. Hi, everyone. My name's Esther.
Can everyone hear Esther?
Can everyone hear me okay? Yep.
Great.
I'm a Senior Projects Officer for Allied Health based in York and Northern Local Health Network, which is in regional South Australia, covering Port Pirie, the Clare region and the York Peninsula area. We've also got joining us today Andrew Dalby. Andrew, did you want to just introduce your role? I'm going to get it right.
Sorry, yes, my name's Andrew Dalby. I'm one of the nurse managers with CENSTAR, which is the Central Staffing and Recruitment Team, and we manage all the recruitment and onboarding for the nursing division for the 17 hospitals that make up the York and Northern Local Health Network.
Thanks, Andrew. And we also have on board our community connector, Alan Zubranick, today. So, Alan, did you want to just say hello?
Yes, hello, folks. Good to see you.
Wonderful. Alan's from Regional Development Australia. What we have just been doing is we're near completion of a 6-month concept pilot for Port Pirie community only. The Regional Development Australia, York and Mid North, have taken the lead on this and have been providing Alan as our community connector in kind for the past 6 months. And we've partnered with, RDA have partnered with 3 partner organisations for the pilot. So we've got the Port Pirie Health Service, so part of York and Northern, and Allied Health. We've also got Helping Hand, and Port Pirie also have a lead smelter near Star, who make up a huge percentage of the workforce in Port Pirie. So they have also joined the pilot as well. So we are just finishing our concept pilot, and we've got a meeting this afternoon. So we are right at the start of the journey, and I guess our next steps are looking at how we can set the governance of the program up and look at something that's sustainable and review how we've gone. So that's what we got, some wonderful people around the room who have been doing this for longer than us. So really looking forward to seeing what you guys have done.
Okay, and just so that you know who's in the room, South Australia, there's Glenn Ennis in the room. Karen is, so they were the original pilot site, and Karen is the community connector there, and this timing's a little bit difficult for other members of her committee, so they watch it on replay. The mid-north coast, can you wave who on the mid-north coast? As I've said, there's Brie, there's Kate, who's the community connector, Alan, Karen, the community connector, and Sally, who's the committee member. And Bundaberg, can I have a wave from Bundaberg? Okay, so Gail is both community connector at the moment and her own, she's the lead. She's everything. She's the rural. And Olivia's from the PHN in that area, and they're coming together, really interested in this program and spreading the good word across parts of Queensland. Have I got everyone? And Monique, I'm just trying to remember which group you belong to. Who's Monique? Does Monique come? Hello?
Hello, I'm with the Mid Coast with Brie.
Okay, all right. Are you able to have your camera on? Is that okay?
Yeah, sorry, I'm just eating my lunch.
That's right. Does anyone mind if she eats her lunch? No, that's
Okay,
fine. In fact, I encourage you to eat your lunch. Put this at lunchtime. Okay, so off we go. Brie, everything good your end? Okay, I just want to, there are many good things happening in the north coast of New South Wales, and in many ways this site is really fulfilling what I would think are now my key recommendations, which I'll post up on the Facebook now. And I've just rewritten those this year. I invited Brie, who's been a committee member and a rural leader in her community for quite some time, to take us back over time and talk to us about all the good things that are happening there and the challenges that they face. So you're all at different places. Brie, let's get going. So Brie, we'll kick off straight away. What inspired the initiation of the Community Connector program in your community, which is the mid-coast of New South Wales? And if you'd like to just explain the geography of your area and the challenges.
Sure. Yes. So we're on the mid-coast of New South Wales. So we're about 2 hours north of Newcastle and probably an hour south of Port Macquarie. So we actually have one of the largest LGAs in Australia, but we confront many of the same challenges that you would be in terms of workforce recruitment and retention, particularly with health workforce. Our journey with this actually started pre-COVID, probably 6 months before COVID. And one of my roles with Mission Australia is I'm the convener of Mid-Coast for Kids. And Mid-Coast for Kids is a collective impact initiative that focuses on strengthening child and youth serving systems in our region. And so we were doing a lot of work on early developmental health screening and the issues within that system that meant that a lot of our children were turning up to school not ready to learn and were developmentally vulnerable across a range of domains. And so we have done a lot of work on redesigning that system and embedding some research to address it. But what we realised was that if we didn't fix that, if we did get a lot of children being screened, and we started to identify that there are a number of developmental issues to be addressed, we didn't have the allied health care providers to meet the need. And so we realised we had to work on both sides of the coin in terms of that particular problem. On that basis, I started putting feelers out in the community around this issue to see if we could learn more. And long story short, we very quickly realised that this was an issue that impacted on people right across the lifespan. It wasn't just something that impacted negatively on children and young people. We decided we would take a whole of community approach. Being someone who's focused on systems change and collective impact, that really starts with a deep dive into the problem. We started out with having 2 community consultations with all of the stakeholders in this space. And that was from allied health providers, employment, universities, anyone who had a stakeholder. And we were able to wrestle with what the challenges were around the allied health and other health workforce shortages in the region. Long story short, we ended up forming a group who developed a strategic plan for this initiative. And it's actually broader than the Community Connector program. The Community Connector program for us is one strategy amongst a broader objective to address key issues across that domain. But it was the Community Connector project was very early in the piece, was identified as a part of the solution. So we identified key people from across that strategic planning group and the community who would come and form a governance group in order to get some momentum behind this project. And what's wonderful about this initiative is it's very much reflective of the various stakeholders in the community. So we have representatives from council, community services, health, education, the business chambers, disability services, as well as allied health providers. And so that gives us a really robust structure from which to work from, a really rounded field of knowledge to draw on. And it allows us to understand the various sectors and what stakeholders they actually have in this space. But I guess one of the benefits of this long build, as Kath said, we've been at this for a while, is that it's really allowed us to develop relationships, develop trust as a group, and to understand how one another works, to understand the strengths of individuals and respective organisations within the governance group, and who's best to play what roles in that sense. So I guess that long build has been really advantageous. Part of that long build has also been about understanding the Community Connector project, the Attract, Connect, Stay model, but then also having to translate that to the allied health and other health workforce businesses in terms of its advantages and its potential to solve this particular problem. And that there've been challenges with that, but I think that we're starting to make some traction. Yeah, I guess the advantages to the long build is that ability to build trusting relationships across your governance group, and that to really understand how you work together well.
And Brie, thinking about that establishment phase, can you think of a pivotal moment or a significant challenge during that phase and how you navigated it?
Yeah, I think it's one of those things where you have to be really adaptable and agile, I think, when you're implementing a project like this that has limited examples of it being operational in communities. And the challenges emerge through the experiences that you have. We held a community meeting where we were looking to actually get businesses to invest so that we could actually effectively test and pilot this role in community. And it's through those conversations, through the extended process of inviting stakeholders in, where we learned that there was reticence or there was a lack of understanding around how this particular service would actually enhance their ability to recruit and retain. There was this understanding that they had to advertise and within Seek. And so what we still have to do that, but then we pay you on top. How does that work? And am I guaranteed any return on that investment, etc.? So there were key challenges that emerged within that. And we had to keep coming back to have discussions around how we're actually communicating the program, how we're marketing the program, to really take a deep dive into what's getting in the way of businesses wanting to actually invest. And so we had to work through that. And we're really fortunate that we do have somebody who has a significant career in marketing on our governance group. And that's been advantageous around that and clearing through some of those issues. It was just acknowledging that there was an issue there, but really investing in conversations with those people that are your stakeholders to understand that problem so you can understand how to respond to it effectively. And I think we have got some traction in that space now, and that's real. We've been really grateful to people like Monique, who's from Catholic Care, and Sally from Early Connections, who were our early investors, who allowed us the opportunity to get some runs on the board and demonstrate the efficacy of the role. Yeah.
And in terms of governance, what unique approach did your community adopt for the Community Connector program? And how do you think it's impacting your success so far?
When we were first looking to put a governance structure together, we of course have looked to examples that you have with Glenanus and that sort of thing. And I guess that was our starting point. But I guess the key lesson that I've learned through that is that don't be in a rush to try and lock that down. You're in this learning space. You're still working out how to work together. You're still working out what is required in order to support the community connector themselves, the actual program itself, and the resources that are required. And that's an evolving and developing understanding as you implement. So I would say absolutely lock down those key things. Who is your auspice? Where is the insurance coverage coming from? That type of thing. But in terms of refining that governance structure, allow yourselves to time to to implement, to learn key lessons, to give yourselves permission to revise and going, we thought we would need a whole group in order to advise a community connector. Actually, we don't. All of those skills that we wanted are actually in the governance group, and we can actually just draw people in from community on a needs basis. So when we thought we'd have 2 tiers in that governance structure, we actually just dismissed one whole tier because we've actually got it covered within that particular group. I guess the key lesson is there, give yourself time to do it. In terms of reference or a governance structure, it's meant to be there in service of you and your objectives. And if it's not working for you in the way that you've designed it, we'll change it. So the way that we're actually structured, because I think it's helpful.
Do you want to share, Brie? Have you got a diagram for it?
No, I don't actually, because I'm still trying to work out how to paint it.
Okay.
But our actual terms of reference are actually going to the meeting next week to be adopted. So I'm happy to share that with the group once that's done. But we actually have, so it sounds complicated, but Mission Australia, we are the chair for this particular initiative. Our business chambers act as the treasurer, and they actually subcontract our community connector and make sure she gets paid. We also have a secretariat, and that is our health service that provides that. And then we have our disability support service, which is Dundaloo, who provide the insurance coverage and risk management for the initiative. We then have Catholic Care and Early Connection, who Catholic Care is our co-chair so that in the absence of the chair, they'll take responsibility. And then we also have Early Connections playing an integral role in representing this particular group and obviously actively contributing to the work of the governance group overall. So we've quite evenly divided responsibilities amongst the partner organisations. And one of the other stakeholders who sort of sits in the background of our governance group is our local council. So while one of the executive leaders from our council sort of sits and hovers, provides advice when he needs to, but doesn't want to be overly involved in the driving because they are actually a financial investor in the project. So I guess that what works in that, Kath, from my perspective, is that it's a good partnership model in the sense that we've managed to really distribute the risks and rewards of this project. Everyone has a responsibility to some degree. They're accountable for that through our governance meetings. And to my mind, there's a level of equity and fairness in how that is distributed. When it comes to things like applying for grants, like if we proceed with the welcome experience, we're having very open conversations around who's the best lead and why. There's no openness to who will provide those roles. And so I think that, we've formed a really healthy, balanced structure that is a reflection of our project and how we've brought it into being and what's required in order to carry it forward effectively and in a way that is sustainable for people who are effectively doing this off the side of their desk. In the sense that none of us are specifically paid to do this except Kate doing the role, but there's a lot of goodwill in this project.
Okay, and just some questions around, can you talk about who it is, what sort of role they hold in the organisations?
Yep. Okay, here we go. So the Business Chambers representative is actually the president of the Mid-Coast Business Chambers. Dundaloo is the CEO representative. From Health, we have the Director of Integrated Care and Allied Health. Correct me if I'm wrong, guys. We have Sally, who is the Manager of Early Connection, a major allied health service provider in the region. We have Monique, who is a Program Manager with Catholic Care Social Services. You have myself, who is a Program Manager overseeing a range of programs, as well as the Mid-Coast for Kids initiative. Who have I missed, Sally and Monique? I think pretty cool. Oh, and I guess Paul is an executive lead from council in terms of his advice. I guess the key message in that is that there are people in the organisation with power to make decisions without having to go back continually to be able to seek permissions to execute the work. And that's really good. In saying that, I think it's always important to have community and consumer voice represented there somewhere, and that's probably where we'll look at developing our structure at some stage to ensure that is there. But we've just been so focused on the nuts and bolts of getting this operational that those that are around the table are there for a very purposeful reason. And yeah.
Just Brie, can you say when you first approached me and how long it took to actually get to recruiting Kate?
Okay, so I think it was probably, would it be 2 years, Kat, roughly? Because we had to look at how we were going to fund this role, and Kath had provided good advice that those communities most likely to sustain the role were those that would invest in it themselves and find ways to do that and not be reliant on external funding opportunities that are time limited. So we've really tried to do that, and the initial way to get this up so that we could test, pilot and give that proof of concept was to try and attract investment so that we could put on a community connector who could get some runs on the board. And so that's what we did. And we attracted $110,000 in investment, with the better portion of that coming from council in a one-off contribution. The other contributions came from the community service providers that came around the project. And so that's allowed us really to put Kate on for 12 months. And then in that, we've basically gone, okay, we're going to develop a fee for service model where we're actually charging businesses for the services that the community connector provides. And we've had a lot of challenges around getting health service providers to actually pay the fee. And so within health, there's a large bureaucracy. There's obviously very major constraints there in terms of their processes, but also budget. And so that's presented its own challenges. And then obviously allied health providers, depending on their size and capacity to pay, that's another challenge. And thankfully, it's early investors like Sally and Monique who've allowed us to be able to operate in that space. We've also had the opportunity for Kate to work with council, supporting council employees as well to be able to engage and come on board. What we've realised is that if we're going to go down this fee for service model and try to sustain the role with just that, is that our health and allied health workforce currently is not sufficient to sustain the role in terms of the investment that they're making. So what we've made a decision to do was go where the money is, and there is a lot of interest from the business community to engage this service. And so there's a large manufacturing industry here and James Strong. And so they have people relocating from India in significant numbers, and they think the service is amazing and have no hesitation in whipping out a credit card to pay for it. And so that's been great because it's allowed Kate to really help build her networks, to sift through some of the challenges of relocating people from overseas. And she's also been able to help their partners secure employment. But so for the time being, while we're trying to build that sustainability, we are supporting other industries to link their people. But we have reaffirmed that our commitment and that what we're focused on is addressing allied health and other health workforce shortages. That is why we formed. That's our priority. That's why most of us are at the table, because we're invested in that outcome. And so that will continue to be the case. But we've realised we really need to hold a balance between industries in order to sustain the role over the long term. And it's not a guaranteed thing at the moment. We're still very much working through the challenges and opportunities there. And messaging is still something that we're having to work through.
Thanks, Brie. I just want to quickly go the welcome experience that Brie mentioned that they're looking at considering tendering for. So is the Glen Innes site. It's a New South Wales program that when it was being developed by government, the New South Wales government, it is based on as well as some other research, but definitely the Attract, Connect, Stay, and we're mentioned specifically. So the marathon model from which this was developed, it is the potential, and we'll talk about sustainability in the moment, but it is a real opportunity for those existing sites in New South Wales. Unfortunately, it doesn't exist everywhere else, but it's close enough. It will help these communities, if they're successful, to assist their sustainability. Talking about sustainability, financial sustainability is crucial and a worry for all the sites. What strategies has your committee implemented? And you've just spoken about fee for service and going for that very early in the pilot phase to ensure that the longevity and the survival of this program into the future.
When I said that there's benefits to having people from such diverse fields, what I mean by that is business approaches these types of issues in one way, community services do in another way, NDIS suppliers do in another way, and local government do in another way. And that can be a point of contention, or it can be an opportunity to capitalise on a whole range of different investment models. From me, from a community services background, block funding through grants is my bread and butter. Through disability, it's NDIS type thing. And business, it is fee for service. So really, I think that we're open to all, whatever's on the table to keep this thing running. And so while in an ideal world, I think that the fee for service model would be best because it allows us to stay in control of the objectives. It allows us to set the community priorities and to work in really diverse ways. There are still challenges with that. So we may need to take up this welcome experience opportunity in order that we can then continue to refine the model and to also have the time to actually, in the event the welcome experience funding doesn't continue beyond 2 years, that we're still looking at how we can develop a sustainable investment in the project, be it through other grants, through philanthropic, through fee for service, that will make it sustainable over the long term. And we have a strategic plan and we have a goal that we would have more than one community connector in the next 5 years, and that those community connectors would have different industries of focus, etc. So I would love to see that, yes, we have the welcome experience and perhaps Kate is funded and is driven by the objectives aligned with that, but perhaps we can also recruit another community connector who is actually funded and resourced through the fee for service model. And necessity is the mother of invention. and I think that everybody is going to find that in community. And so really all cards are on the table. We're willing to explore anything that will potentially work, but I don't think that there is one silver bullet. I really think it's going to be a diverse investment approach.
Thank you. And since your Community Connectors appointment, so that's Kate, what success story stands out most to you and why?
Oh, there's so many. Kate, I've actually never seen anything like it, to be honest. Like, Kate has come to us with extended networks across the community, and she has been able to build these professional networking events that bring together young professionals from across the region to enjoy these beautiful events in lovely local locations. And she's also tapped into other existing networks, like business networks, to identify opportunities around conveyances and real estates to come up with creative solutions to housing shortages, etc. So she's just so driven. She's proven that her networking capability is exceptional, and that's translated into outcomes. And I think we've landed on some allied health providers because Kate's actually been helping engineers, etc., to relocate to work for council, but they happen to be married to an allied health provider who comes into the region as a result of the work she's done with the partner. That's all been really interesting for us to observe, going, oh, okay, that was an unintended benefit. But Kate's also demonstrated a willingness to go above and beyond in this role to help solve problems and to make sure people are connected. The survey results that we have from those who have used her service are 5-star all round. They can't sing her praises highly enough. but I think it's just her adaptability, her flexibility, her likability that are making her really effective in the role.
Brie.
No worries.
Facing ongoing challenges as part of any program's growth, can you share a current challenge and your committee's approach to solving it?
Well, I guess it's this. It is this funding. It is a sustainability question, and I suppose what I think we're doing well is that we're canvassing all of the options as a group in a way that's really cohesive. I think we're also, this work is quite political as well, in the sense, particularly when you're dealing with large bureaucracies who have to be communicated with in a different way. And sometimes that stuff can get prickly. But I think we've got enough skills, knowledge, wisdom around the table that we work together collectively to navigate those situations. There have been things that we don't realise that we're come up against the limits of our governance sometimes until we're in that moment. So it's okay. Well, if there is a presentation to be made to, say, health internally and executives, whose responsibility is that to actually provide a formal proposal and to present that proposal? Is it the role of the community connector? Is it a role of the governance group? And what are the potential opportunities and risks of taking either approach or a collective approach in that way? So sometimes because it's new, we actually have to come up against some challenges before we realise we need to actually expand the governance guidelines to encompass that particular situation. But I think we're doing well, to my mind, and Sally and Monique, I don't know what you think, but I think that we've just got amiable people with we have a common vision for what we want to achieve. We're prepared to work together. We're prepared to commit time, and we're committed to working through those challenges in a way that is constructive. And again, I would just mention just that diverse industry representation really adds to our ability to navigate those challenges well.
Can I ask, had that group of stakeholders come together before? Is this the first time you've come together like this?
Yeah, no, I think because we're in a regional community, like we all outside of this particular project have connections, but certainly many of those were new to us as a group. And I think the way that it was built, it was really that conversation around who needs to be at the table and targeting specific people. There were also those that very early identified as having a drive to want to solve this problem. And for the business chambers, that's around filling those workforce gaps. For allied health providers, it's around getting the staff they need to provide the services. For people like me, it was a strategy to achieve a social outcome. So we're really coming at it from different ways. And in a lot of respects, those people were self-identifying in that sense. I also think that you don't have to have everybody around the table. You just have to have the right people around the table. And so I don't think we have to have everybody represented. Everyone has to have a voice. That's not necessarily the case. Or there are ways and strategies through which you can engage peer groups that don't mean everyone has to sit around the table and have a conversation. And I know this sounds a bit funny, but we're also a group of people who are all very time poor. When we come together, it's business. We're very efficient. We have an agenda. We get it done, and then we all go our separate ways. We do our bits and pieces, and then we come back together again. But yes, there's disadvantages to being a time poor mob, but there's also efficiencies to be gained in terms of having that constraint. I think the other thing about the people around the table is that they have a reputation for being good partners, for for doing the work and being closers in that respect. So I think we've all worked with people who you have to drag along by the teeth, whereas these are all people who are putting their hand up saying, what can I do? I can do that bit. Yep, no worries. And they deliver within the expectations of the groups. That's really advantageous as well. So be selective about who you have and why you have them there.
And how often are you meeting, Brie? Do you meet regularly or on an on-needs basis?
At the moment, it's about once a month. So we were talking about meeting more frequently as there was a need to, but we've really started to smooth through some of that governance stuff, which means that a once a month is where it's at for the time being. That might change into the future. We might need to only come together every 3 months, but I think until we're established and still we have a pathway that is financially sustainable, that we need to keep up with that regular communication.
And if Kate has a question, where does she take it to the committee?
So we've actually formed a little, we've actually formed a little group, and this, when I work out how to put this into a picture, Kath, I can send it. But it's actually, we haven't even really named it, but it's a support group for Kate. Sally, myself, and Deborah Bliss, who is from Health. We have an intention to meet with Kate basically once a month for an hour, where she can come and share what are the challenges, what she needs support and help with. But she knows that she can also contact any one of us at any time in between in order to get some immediate support. And Kate's been really great with that, with me as well. And often the things Kate will come to me around are things like boundary issues, because sometimes what people come to her with is quite heavy, it's quite full on, it quickly falls outside the scope of the role. And for Kate to have a sounding board to work that through so that she's not in a position where she's overreaching or whatever, it's good for her to have somebody there who can respond quite quickly. So we're her little support group. She doesn't have to take everything to the governance committee. And then every governance committee meeting, Kate gives us an update on her activities, provides a bit of a report, and shares those opportunities and challenges as well.
And I'll just add that that committee has also invested in Kate to be trained one-on-one with myself and to join this network where she has a community connector. So she's got a number of wraparound supports, and she can ask that boundary question is in just about every forum Kate's involved in. So lastly, if you could distill the essence of your community connector program's success into what I like to call the secret sauce list.
Yeah.
Would be on that list?
Really effective partnering practice, I think, in terms of that there is a common vision for what we're doing. There's an understanding that everybody has something to contribute and that the risks and rewards are fairly evenly shared in how that's been set up. I think it's about having the right people with the right skills and the right level of commitment around the table. And I think that ability to be flexible, adaptable, from treating failure as a learning moment and not a failure in general, and having that as a part of the culture of the group. Everything's just a problem that we've just got to solve and work around, and if that didn't work, then we try another tactic and we keep going until we get a solution. So I think that can-do attitude is a big part of the secret sauce too, Kath. I think also too that those people that are with us have really effective networks that they've built over time that we've been able to capitalise on as well. And so again, that comes back to right people around your table.
Great, thank you so much, Brie. Have you got time to stay for Q&A?
Yep.
Great. I'll ask you to put questions in the Q&A, and I'm going to open it up to Sally, Monique, and Kate as well at this point. And just, have you got anything else to add to the conversation, and in particular to the secret sauce list?
I was just going to add the biggest element of secret sauce I've found is Kate finding the right community connector. She has just been gold, as Brie said previously.
Thanks, Sally.
Thank you, Sally.
I think I don't really have anything else to add apart from what Brie and Sally have said. I think that really encapsulates everything that is making business success for us.
Okay. And if has anyone got any questions? Can I see just
there's one in the chat there, I think.
Gail?
Oh,
Yeah,
I just put a question up.
Alan, just I'll go to Gail first. Just put your little hand up, and I'll come. Gail?
Thank you. I've written quite a number of notes here, but you mentioned there, Brie, around not enough allied health services to pay for the service for it to be sustainable. Is there an option there, and this would apply not only in allied health, but for those businesses and organisations to seek the funding for that workforce community connector to come in. So similar to some funding models for some businesses around HR services or other aspects that I've seen. So then businesses are actually getting funded and then they choose to spend that funding with you.
Yeah, I think that sounds like a wonderful idea. It's not something that we've explored to date, and I guess it's just contingent on having the right funding opportunities for them to apply to in order to direct towards the program. But yeah, I think that is another line of that could be worthy of exploring.
Okay, and of course, Kate, Monique, Sally, if you've got anything extra to add to these questions. Alan, we'll go to you next. You had a question? You're on mute.
Sorry, Kath. Yeah, I put it in the chat as well. Curious about the council contribution of $110,000 that you mentioned before. Is that just a one-off?
Yeah, no, the council contribution was only $60,000 and it was a one-off contribution. The rest of the monies came from different allied health and community services who invested upfront in order to enable the program to be tested and piloted. I think there is an indication from council that that investment really won't be repeated in the way that it has. It was really startup funding, I suppose you could say. We've also had to wrangle with, and this is something that we'll have to table for discussion, but that what did that $60,000 investment actually buy council? It was because that really wasn't articulated at first. This was really some enabling money, but to what extent is our community connector then obligated to provide some settlement type support services or connector services to council's employees as a result of that? And we really need to open up that conversation with council around making some of their HR budget and the funds they do have to help people relocate to potentially be redirected to the community connector in order to make that viable, because we can't continue to just provide blanket support without some clarity around that. It's not sustainable.
Yeah, so I think that's a really interesting one for when people put money on the table, which that came very early on the piece, didn't it? And we weren't ready to ask the questions then around what did that mean?
Yeah.
And now it's coming. Esther, I think, was the next one.
Thanks, Kath. Kate, it sounds like you put some wonderful strategies in place in your concept. Both, or any of you guys, just wondering if there's a bit of a menu, the fee for service structure. It sounds like you've put some things in place. Just in terms of how, or are you there yet? Have you designed something like what people are getting for their money in terms of the fee for service? Is that being developed?
You want to respond to that, Kate?
Yeah, sure. So basically from all of the people that we have worked with already, we were trying to work out what was the average number of hours that we were doing. Some families were coming through and it was taking a lot of the time, and then some people were coming in, it was only 2 or 3 hours work. But we came up with an integration package as such to help them settle and integrate into the community, where businesses can buy, it was $1,500 for 10 hours of support, and then I really have a whole range of things that I can help people with. And then some people might already have housing, some people won't, they might need help with something else, but basically they can explain to me what they need help with, and then they would get that service in that 10 hours of support. There has been organisations, like Brie was saying with James Strong, so they had multiple employees. So all first up, they had 4 employees. So rather than charging them $1,500 per employee, we were charging $1,250. So giving them a little bit of a discount, knowing that they are going to be also opening up a whole new section in their business later in the year, where they're hoping to have another 22 employees come in, which a lot of them will be from overseas. They will definitely, hopefully, use the service for that. But with that is a whole range of things, because we can help with kids for schooling. Partner employment is a really big one, especially the internationals that are coming in. Many of the wives that I recently had didn't speak any English, so finding them work was took a little bit of extra time, not doable, but just took more time. So yeah, we just basically had those, and then there's some organisations where we'll have an hourly fee. At the moment, the hourly fee is about $150 for an hour, and that might be an organisation that might want me to speak with a candidate before they even apply for a job to talk to them about what the options are locally for them. But realistically, we're more driving towards people buying the packages as such, because that's going to really sustain the role. But yeah, we're about to open a website. So in probably about 3 weeks, it will be up and running, which gives all the information about the Connector program. People can buy the packages, so then any business in the region can, if they've got new people coming in, they can just buy the package and they'll automatically get started. Yeah, so it'll just educate people, and it'll be an easy service for people to access. Yeah.
And the other thing too of that, Kate, is that we realise that it's a package we can sell to anyone. It's not just about health workforce businesses. It could be a parent who wants to relocate a student here in order to do a student placement or to undertake study that can pay for that. It can be a football club bringing in some sports people to join their team who can do that. It could be an individual who just wants to pay Kate for 3 hours of support. We actually put together a prospectus for health, which we've since modified for different businesses, etc. And pretty much it outlines what you're requesting. And I'm happy to share that with you guys, and I can send it to Kath to forward on. But as Kate said, it's pretty much $1,500 for 10 hours of package, $1,250 for businesses wanting more than one. And we also are promoting to those businesses that if you've bought a package, you can actually add extra hours to that package at $150 an hour if you've got someone who has more needs in terms of settlement. As Kate said, it might be those coming in from overseas who are not speaking English who require that additional support. But yeah, it's one of those things, again, we're just flexing and we're finding where the opportunities are. We're starting to look at, the different groups we could market to. We were not ready to be thinking about these things at the beginning, but as we start to apply, we're going, oh, hey, that's something we didn't think about. Yeah.
And I'd just like to jump in there. How we got to those prices is that we looked at the costs that the Mid-Coast would bear to run the program. But we were very much informed by what we knew from the longest running site, which is Shepparton. And we put those together and we did a number of spreadsheets. The very first one I did was with the committee before Kate was brought on. And we've just kept working at that and bringing it back. And Kate and the committee's role has been capacity to pay. And because we really want these as lead magnets as well. And certainly some of them are very much about trying to get people to use the program, because we know once they do, they're pretty much, the quality's there and we don't have to do much sell from that point. So it was something we all worked on together, and I don't know how many iterations we had, just about as many governance iterations as we did budget ones. Yeah.
And it was that balance between what we need to cover the role, but the market's willingness to pay. And just reading the documentation from the welcome experience, I find it really interesting that they came to a cost for service at around $1,486 or something like that. I was, we're bang on after all.
I like seeing that too.
Yeah, it's actually, we came up with a good market proposition that was in line with the market. So we did well, but it took a while. Yeah. Really took a while to come to that. Yeah.
And Olivia next.
Yeah, hi. Thanks so much for sharing. It's really helpful to hear. Mum, just a quick question. Quite early on, you were talking about some of the challenges that you found from health services and providers in terms of putting their cost to the recruiter connector program, around like having to pay for SEEK and then did you document any of those learnings, and is there anything you can share in that regard?
We didn't document it per se because some of it's not politically correct.
Or just like anything to share on that.
Yeah, I think if you look at a bureaucracy like health, you've got those executives that are just trying to deliver a service and they're just trying to get those roles filled so they can do that and meet their KPIs. Then you've got HR that they're forced to work with that have their particular way of doing. They have a particular budget to spend, and there are real restrictions around how that money can be utilised. But you have to fight a lot of assumptions along the way, and this is why we did come up with a prospectus so that we could dispel some of these assumptions. There was a comment by one person within health as in, I'm not paying for that person to go out to dinner. It's just that's not a good value for money proposition. How am I going to explain that to the government that I'm paying them to go out have coffee and have dinner? that's not what it's about at all. And that's where we just had to respond to that. If that's the kind of feedback that's coming through, how do we respond to that? How do we change the messaging to alleviate the kinds of concerns that come up? So, and that's just one communication. So we went away, Kate, Anna, myself, we started working on a prospectus that really responded to the concerns that we were hearing, that put it together in a very succinct package that was easy to digest by the executive and those that were there. And that's made things a lot probably easier for Kate too, because she's not having to repeat herself. And the website will be a really good opportunity for us to tell that clear story and to share the value proposition of the investment. One of the other things, having someone on the inside of health, is, we've been able to do little things like play with the language. It talks about this is something that you can actually invest in to improve your competitiveness in terms of attracting staff. It's a way you can demonstrate that you're serious about employee well-being right up front. So having this service connected to you makes you a more desirable employer and a more competitive employer when people are looking at multiple opportunities. So we've had to think about what is the value proposition for them? How do we communicate that it makes sense for them to invest those monies? But again, it's having to hear the negative feedback and then go, okay, what do we do with that? It's not just like, oh, that's so rude. What do you do with that so that we can overcome that hurdle?
Okay. Thank you. And I just want to point out that, Carly, you just want to wave your hand. That's Southern Grampians. We've got the unusual case there that they don't have any other collaborators, but the health is actually paying for their program. So it lives in the health, and we're trying to get it to live outside of health. Reach out there. I've got the community connector, but there's also another health representative. And so we've got the opposite problem.
Well, it's interesting.
But the bureaucracy is well and truly alive, isn't it, Carly? Yeah, we spent a lot of time trying to make it work in health. Yeah. Without health, may I say? I've seen that's quite possible not to have health, but it was a very big, important partner for Shepparton. Gail, last question.
I just had a real quick one, just on the community for the community connectors, and just coming from community services, there's a lot of organisations that are doing community connection for their specific group of people. If you come across someone, like you said, around people who don't speak English, that my initial thoughts are, I'm just going to connect them with those community connectors who work within the multicultural services and go, here you go, I'm going to refer you here and they are going to look after you? Or do you still hold on to them and work with them? Like, how do you handle working with those other community service organisations who do a similar job but for a different demographic?
Yeah, and obviously I'm looking at services everywhere in the region at what I can connect them to, because I know that my service is not going to be with them forever and they can't hold on to me almost, it's actually like babying them a little bit to take them to things, because I need them to be able to do it in the community on their own. So I definitely look at outside services that I can link them to. I have to, every person that I work with, link them to at least one or two service that I know that's going to benefit them, where a place where they can go. But also making calls. Since I started working with Indian families, I've even got the private phone numbers of all other Indian families, and I'll call them up and say, hey, you're from like southern India, like I've got this other family, you actually only live like a couple of streets away, do you want to maybe meet up? And then we go and meet up, or they just meet on their own. We give the numbers, and actually we've got a really big community, especially of people coming from India. There's massive, like even in Tari alone, just from southern India, there's 78 families that have relocated in the last 3 years or something. So once you have wives and children and things, there's a lot. But yeah, no, they definitely need to be linked to other services. I'll try and help them as much as I can, but if there's something that I can't do, then I definitely need to look at another service. But yeah, and I'll take them to the service to, make sure it's an easy transition.
Okay. Thank you, Kate. Okay, we're out of time. I hope this has been valuable. I'll pop it up onto our Facebook group, which I think you're all on, for Esther and co. I'll work on a way to share resources with you as well. Please look at your Facebook group regularly. Now we're all up, I'll start posting things and asking questions and planning the next one. I thank you very much, Brie, for your time and your preparation for this. We look forward to seeing your diagram of your governance, and the prospectus is great, guys, so we'll definitely pop that up. Thank you, everyone. Look forward to catching up with you next month, and I'll have been to New Zealand, where our next site is in the Wairarapa, and they should join us fairly soon, so that'll be really interesting. So more sites coming. Thank you very much, everyone. Take care. See you.